In this video, we'll be discussing depression. Depression is a common term that's used in the society, and most people are aware of what it means to be depressed. We use it in our everyday lingo to describe a feeling of being very low, such as when your car crashes on your way to work on a Monday morning and you spend the rest of the day feeling extremely low. We tend to say we are depressed. But in today's video, we'll be focusing on the term major depressive disorder. This is a medical diagnosis, and it's usually defined as a debilitating disease that is characterized by depressed mood, diminished interest in things previously found enjoyable, plus a couple other symptoms of feeling low over a prolonged period of time, typically at least 2 weeks. To be diagnosed with major depressive disorder, 5 or more of the following 9 symptoms are required over a span of at least 2 weeks, with 2 of those 9 symptoms being depressed mood or loss of interest in things previously found enjoyable. 2 of these must be involved for a diagnosis of major depressive disorder. The remaining 7 symptoms include sleep disturbance, feeling of worthlessness or disproportionate guilt, fatigue or loss of energy, diminished concentration, weight change, psychomotor changes such as agitation, and lastly, suicidal ideation. According to the World Health Organization, an estimated amount of 3.8% of the entire population suffer from major depressive disorder, and this comprises of 5% of adults and 5.6% of adults over the age of 60, making this a total estimated amount of 280 million people worldwide. Some of the causes of major depressive disorder is still unknown, but there's been some hypotheses that include a multifactorial cause of major depressive disorder. And some of the theory hypothesizes that major depressive disorder could be caused by genetics, and there's a study that showed a concordance rate of major depressive disorder in identical twins being at least 50%. Other causes include psychological traumas and experiences, as well as brain trauma or injury. There's also been a hypothesis that major depressive disorder could be caused by an imbalance in the nerve signals in our brain known as neurotransmitters. This is because most antidepressants work by inhibiting the monoamine neurotransmitters such as serotonin, dopamine, and norepinephrine. Therefore, it indicates that a lack of these neurotransmitters could play a role in the causes and pathophysiology of major depressive disorder. It is important to note that to be diagnosed with major depressive disorder, the absence of any other medical or psychiatric conditions that present with similar symptoms must also be excluded. Some medical conditions that present with similar symptoms include dementia and hypothyroidism, which is low thyroid, and psych conditions such as bipolar or mania must also be excluded to be able to make the diagnosis of major depressive disorder. Treatments for major depressive disorders include psychotherapy such as behavioral therapy, medications such as antidepressants, as well as some other non-pharmacological methods such as exercise, yoga, breathing techniques, and focusing on things that we found pleasurable and enjoyable. If these fail, then it is important to seek out the advice and therapy from a licensed healthcare professional. In summary, major depressive disorder is a very prevalent disease that affects both males and females throughout the whole world. And 5 out of 9 of the symptoms discussed earlier are required for diagnosis, with at least 2 of those symptoms being depressed mood and loss of interest in things previously found enjoyable. And the symptoms need to occur over a span of at least 2 weeks. A diagnosis needs to be made by a licensed healthcare professional, and there are various treatments currently available to help tackle major depressive disorder to enable the individual to go back to living their appropriate best life. Thank you for watching this video. Please do leave a comment in the ways that you tackle depression in your own life and what the term depression means to you. Thank you and have a good day. Bye.